cause will be, this is a specimen of breast showing a mass in nipple areola complex suggestive of breast carcinoma. Next question will be, what are the types of breast carcinoma? Okay, can anyone tell me? CIA হচ্ছে okay. So there are histologically mainly two types of breast carcinoma: ductal carcinoma and lobular carcinoma. Lobular. Because breast has TDLU, terminal ductal lobular units. Two types of cell, two types of carcinoma, from ductal cells and from lobular cells. Okay, and these have different features. Most common is your ductal carcinoma, and ductal carcinoma in situ also occurs. Any tumor has in situ part also. Means only in that part, means it does not invade. Okay, ductal carcinoma also. Here you will see, this is called bread loafing. Bread loafing. When you do gross examination of a breast, when the specimen comes, you have to do first gross examination. That I will tell you tomorrow. How the specimen comes and how we convert it into a slide. How do we see? Tomorrow's class. So here, what we do is grossing. Gross examination. In gross examination, you have to first cut here bread loafing and see where the tumor is. Okay. And here we saw the tumor was here and extending downwards. Okay. We have to see tumor's margin, distance of this tumor from all the four margins, that is your superior, lateral, inferior, medial, and deep margin, deep resection margin. Okay, from where to see. If it invades any of the margins, this means resection was not complete. Means there some part of tumor is left inside the patient. Hence we have to give further therapy like chemotherapy and everything. In breast cancer, we usually give chemotherapy, tamoxifen and that, depending upon its ER/PR Hertz status. ER/PR is estrogen receptor. PR is and Hertz is. So we divide actually according to ER positive, ER positive, HER2 negative, or all negatives, or these two negative, HER2 positive, like this. For HER2 positive, you give Herceptin. I guess Herceptin was here. There is a specific drug for HER2 positive patients. And for ER/PR positive, it means prognosis is better. Okay, like this. In histology, what you will see, as shown in ductal carcinoma. In lobular carcinoma, there is a typical formation called Indian file arrangement. Indian file arrangement is tumor cells form a line by line. Okay, because this term comes from in some old Indian pictures where we used to see the soldiers in Indian cavalry standing one by one behind. Indian file system. Okay, so Indian file system of your lobular carcinoma. Okay. And this specimen is your uterus cervix, that is leiomyoma. Okay, leiomyoma is also called uterine fibroid. So when anyone comes with leiomyoma, LEIOMYO, fibroid. Okay. Here you can see this is a mass. Same mass, half. Same mass. It was like this. This is your endometrial cavity. This is cervical cavity. This part is cervix. This part is corpus.
Body
Body of uterus. This is your endometrial cavity, which is narrowed by this impinging intramural fibroid. Intramural fibroid can be intramural, submucosal, झूलबे भीतर से subserosal barrage हुई. Serosa is outwards, mucosa is inwards. Submucosal within the from hanging from mucosa, subserosal hanging from serosa, and intramural within the muscle layer of the tumor. Okay. Intramural fibroid. Okay. See, this is a section that we have taken and we saw in the slide.
लियोमा है किधर?
हाँ. Grossly, it is hard mass, firm to hard mass. On cut section, it looks totally whitish, and here you can also see fibers, interlacing fibers actually. Line across section, striations. Look at all the striations. See, you can see the striations. These are all actually interlacing muscle fibers. Okay. So, what can happen to a leiomyoma? It can undergo many different degenerations. Okay. Most common is your hyaline, HYALINE, hyaline degeneration. This means this is what? This is a leiomyoma. That is your interlacing muscle fibers. These muscle fibers are replaced by fibrous tissue. Around 50 to 60% undergo this change, hyaline change. Second change is your red degeneration. This mainly occurs in pregnancy, and this occurs due to infarction. Infarction means
Decrease in blood supply, leading to coagulative necrosis.
Myocardial infarction means decreased blood supply. Red infarction. Okay. Then besides that, it can occur also your fatty and cystic. Fatty means replace the fat tissue. Cystic means this fibroid has many cystic spaces. Cyst means any cystic space filled by fluid, cystic fluid. Okay. And the worst it can undergo is malignant transformation. That is called leiomyosarcoma. Okay. I think very easy. And if there was a tumor here, it would be called cervical fibroid. Okay, this is a uterine fibroid. Here it would be cervical fibroid. Okay. And nothing else. Leiomyoma. Easy. This এটা হচ্ছে tumor tract, this one. This whole side. And it has a capsule also. This one is also actually.
ये पूरा है यहाँ पे.
ये पूरा है and this छोटा वाला.
छोटा वाला.
सर बायोप्सी जो ना
ये वाला यहाँ से बायोप्सी लिया.
बायोप्सी ना
हाँ,
सेक्शन.
स्लाइड बनाने.
ट्रीटमेंट फॉर द माঝখানে হয়েছিল
This is the
कट